How do doctors diagnose cryptogenic stroke? Imagine a puzzle with missing pieces. When someone has a stroke but doctors can't find the usual causes, they call it a cryptogenic stroke. To solve this puzzle, doctors follow a detailed, step-by-step process. First, they perform brain imaging using magnetic resonance imaging or computed tomography scans. MRI, especially diffusion-weighted imaging, is preferred because it can detect even small areas of brain damage caused by lack of blood flow. These scans help confirm the stroke and reveal the pattern of the infarct, which can suggest whether the stroke was caused by an embolism or other factors. If multiple infarcts are seen in different parts of the brain, it hints at an embolic source or systemic issue. Next, doctors look at the blood vessels in the neck and brain. They use non-invasive tests like carotid duplex ultrasound, magnetic resonance angiography, or computed tomography angiography. These tests check for narrowing, blockages, or abnormal vessel walls that might have caused the stroke. Sometimes, high-resolution MRI of the blood vessels can reveal vulnerable plaques or vessel wall abnormalities that do not cause significant narrowing but can still lead to strokes. Transcranial Doppler ultrasound is also used to monitor for tiny clots or microemboli and to check for right to left shunts like a patent foramen ovale, which can allow clots to bypass the lungs and reach the brain. The heart is another key focus. Doctors perform an electrocardiogram and use continuous cardiac monitoring to catch irregular heartbeats, especially atrial fibrillation, which is a common source of emboli. Because atrial fibrillation can come and go, prolonged monitoring with devices like mobile telemetry or implantable loop recorders increases the chance of detection. Echocardiography, both transthoracic and transesophageal, provides detailed images of the heart's structure. It helps find sources of embolism such as a patent foramen ovale, atrial septal aneurysm, or blood clots in the left atrial appendage. Blood tests are also essential. They screen for blood clotting disorders, inflammation, infections, and even hidden cancers, as some cancers can cause strokes without obvious symptoms. Elevated D-dimer levels and specific stroke patterns on imaging may prompt further cancer screening. Sometimes, doctors look for infections or drug use that could mimic or contribute to stroke. After all these tests, if no clear cause emerges, the stroke is classified as cryptogenic. This diagnosis guides doctors to consider empirical treatments and often involves enrolling the patient in clinical trials. In essence, diagnosing a cryptogenic stroke is like assembling a complex puzzle. It requires a team approach, combining brain scans, blood vessel imaging, detailed heart checks, and laboratory work to rule out known causes and uncover hidden sources. This thorough process is vital because it helps determine the best strategies to prevent future strokes and protect the patient's health. Always remember, each person is unique, so personalized medical advice from healthcare professionals is essential for proper diagnosis and treatment.